despite the fact that the electronic health record programs have been incredibly successful, it would be a mistake to imagine that the data in those systems is interoperable. It's in fact very much not the case, I think in part simply because of the history of electronic health record development, and also because the lack of data interoperability across electronic health records represents a barrier to exit for the customers of a commercially based electronic health record.
I tend to think that the healthcare field in going digital is so backward that we're almost leaping directly from the 19th century to the 21st. The implications of going from data to insight, if the insights are not accurate, can be very, very serious at both the individual level and the population health level. Because in particular, if you get information or insights on how effective a drug might be or not be, and you make a decision about that drug as an individual, it may turn out to be the wrong decision. It could kill you or not kill you, or make you well. At the population level, insurers may say, no, we won't reimburse, or we will reimburse.
Health care, as big a part of the economy as it is still something that people spend very little of their life doing or receiving. If you spend half an hour at your doctor every 3 months, that's a lot. And even if you're very ill, you're only going to be hospitalized a couple times a year. But your health is something that is happening 24 hours a day, 7 days a week, whether you're in good health or otherwise. So we can't instrument your turbine blades the way General Electric can instrument the turbine blades of a jet engine. But we're starting to be able to instrument the human body both with implantable devices and wearable devices and other devices in the home. Your refrigerator could know much more about your nutrition than I will ever elicit from you by asking you what you have for breakfast, lunch, and dinner. How do we get those data into electronic health records and other systems? Those are opportunities, I think, for commercial and non-commercial innovation in that area, but also important challenges that might seem like we would have solved them by now, but honestly haven't. Besides the fact that you have to ask, what are the data that I actually have and what do they do not represent, you can either have a goal in mind for what you are trying to accomplish. Are you trying to improve the health of your individual patient? Are you trying to improve the health of a class of patients, like people with diabetes or people who get primary care at your hospital? Or are you trying to improve value across the entire healthcare system of the United States? So I think knowing what you're going for and then trying to be directed about what data you choose to use and how you consume those data, I think is key. I think we're sitting on a lot of healthcare information, and there are lots of applications that very creative, smart people from within and outside healthcare can dream up, and I think that's very exciting.